How do rheumatologists use MRI to diagnose arthritis? Imagine trying to find a tiny crack in a piece of glass without breaking it. That's similar to how rheumatologists look for early signs of arthritis. They use a special imaging tool called magnetic resonance imaging, or MRI, to see inside joints in great detail. Unlike X-rays, which mainly show bones, MRI can reveal soft tissues like cartilage, tendons, and the lining of joints. This makes it perfect for spotting early inflammation or damage that might not show up on X-rays. Rheumatologists relying on MRI to detect inflammation in the joint lining, known as synovitis, or in the tendons and bursae, which are small fluid-filled sacs around joints. These signs often appear before any visible damage occurs. MRI can also show bone marrow edema, which is swelling inside the bone itself. This swelling indicates active inflammation and can predict if the joint might develop erosion or damage later on. Another key benefit of MRI is its ability to show early cartilage loss, tiny bone erosions, and soft tissue changes. This helps doctors understand how severe the arthritis is and how fast it might be progressing. Since MRI images can be taken from multiple angles, they give a complete picture of the affected joint without exposing the patient to radiation. When a patient has symptoms that are hard to explain, or when blood tests and physical exams do not give clear answers, MRI can support the diagnosis. It confirms the presence of inflammation and structural changes consistent with arthritis. Rheumatologists also use MRI to monitor how well treatments are working over time by tracking changes in inflammation and joint damage. In practice, MRI results are combined with patient history, physical exams, and lab tests like rheumatoid factor or anticyclic citrullinated peptide antibodies. This helps rheumatologists make a precise diagnosis and decide on the best treatment plan. Early detection with MRI can lead to earlier treatment, which is key to preventing joint damage. So, MRI is a powerful tool that helps rheumatologists see what's happening inside the joint, even before symptoms become severe. It guides them in choosing the right treatments and helps patients understand their condition better. Working closely with your rheumatologist and understanding how MRI fits into your diagnosis can make navigating your treatment path clearer and more confident.